Spinal cord stimulation, what is it? Kind of how does it work? And what are some of the pain conditions that you're able to treat with it?
So spinal cord stimulation, an oversimplified view of it, is it's basically little electrodes that we put in many cases in the epidural space, the same place that women have labor epidurals. We place little leads in there, and what these leads do is they disrupt these impulses, these painful impulses coming from, say, your leg to your brain. And that's where the impulses are processed, is in the spinal cord. And so basically, we take away that signal, so your brain doesn't know that it's having a problem.
Is that right?
Yeah, absolutely.
Is that a very common procedure?
I think it's an underutilized procedure. But in my practice, it's very common for me to perform these procedures.
Are there people, so instead of taking a bunch of medications
Yes.
or opioids, spinal cord stimulation for the right candidate is like a miracle?
It can be an absolute life-changing event. And I have hundreds of patients that came to me on high doses of opioid medications throughout the last 15 years. And I've been able to get them off of all of those medications.
So does Medicaid, Medicare, insurance cover?
All major insurance companies cover it.
Is that right? So it's just a matter of, so if you have a choice between opioid medication and spinal cord stimulation, and many people are candidates for this non-medication, more of a natural approach.
Right.
What's the hesitation for the patient? They don't believe it works, or they just hear the word surgery?
I think it's complicated. I think I think we have an opioid crisis. It's all over the media in this country. But I think we have to look deeper. I think I told you earlier there are over 6 billion people in the world, and 87%, and we have like 360 million or something here, 87% of the world's opioids are consumed in this country. So I think it's much deeper than just patients are afraid of surgery. I think that we're treating a lot of comorbidities, meaning psychological disorders like depression and other issues with opioids. And so there's a hesitation for patients to give up that crutch and use something like spinal cord stimulation.
So in your practice, is it rare that you prescribe a opioid medication?
We use it very judiciously. Say I have a patient who comes in with a compression fracture or an acute injury. I think it's completely reasonable to treat them for 5 days with pain medication while they undergo imaging and before we start the real treatment, definitive treatment.
And I'll bring it up again. You said that maybe 95% of all people on opioids for pain could be taken off.
Absolutely.
Is that right? You believe that? Do you think that'll be the future of treatment?
I think in the future, where we'll have a new algorithm. And I first gave this lecture when I finished my fellowship in 2008 at the American Society of Anesthesiologists. And I said we have this stepwise ladder of approach to the typical pain patient, chronic pain patient. And it used to be the first rung of that ladder was Advil, NSAIDs, physical therapy, and opioids. And I said, this is completely wrong. And then I changed that ladder, and I said, you go through conservative therapy with chiropractic, physical therapy, you do some injections, maybe you consider surgery versus implantable devices like a spinal cord stimulator, and the very last thing that you ever do is give that patient opioids. Why? Because you're writing them off, you're damning them when you put them on opioids.
Wow. So you don't like them?
No, I think they're terrible. I think they've been terrible for our society. I think they're terrible for people. I mean, all the studies now that we have, they go back decades, clearly show that your chances of going back to work after an injury when you're placed on opioid medications is almost never happens. We are dooming these people to a terrible quality of life.
Now you said, I asked you, I said, how do opioids work? And you said, they make your brain just not care about the pain.
Yes, that's
Is that right?
That's absolutely true. In a simplistic view, it is very complex, as you can imagine. There are lots of neurotransmitters and other processes involved in endocrine function. But the bottom line is the pain is still there. You still feel the pain. You know it's there. You just don't care about it. But guess what? There's no free lunch in life. You don't care about anything else either. You stop caring as much about your family,
Is that right?
about all the things that bring you pleasure in life, walking your dog, taking a hike, enjoying the beauty of the outdoors. All of the things that bring you quality of life, interpersonal relationships, you don't care about those as much
because you're
either.
so kind of high or buzzed on it, you don't even know you're missing out.
Well,
So is that why it's tough for them to get off of it?
I think that's, when I talk to patients that have been on these, and as you can imagine, I've treated tens of thousands of patients and seen throughout my career on opioid medications. Most of them, the euphoria is early on in the use of the medications.
Okay.
After a few weeks or a few months of chronic therapy, most of them don't report feeling euphoria at all when they're on these medications. They just don't feel anything.
So they want to get off of them.
Many of them do.
And what are the side effects of opioids? Like the major side effects?
Well, I mean, the big one everybody talks about is chronic constipation, Less known side effects would be in patients that are over 75, much higher risk of fall because it causes dizziness and instability. Yeah, so I really don't like giving opioids.
So driving, things like that could be difficult?
I mean, it's driving under the influence of an intoxicant, right? If you get pulled over on opioids, in many states, you might as well have had a couple of cocktails. You're in deep trouble.
So we're in the numb the brain.
Right.
You might as well go to a spinal cord stimulator or some of these other modalities.
Correct.
And interfere with the pain signal so you don't feel the pain.
Exactly.
It's a more natural approach. I mean, logically it makes sense. Right. So these well-intentioned medical doctors that are prescribing opioid, I'm saying that they're trying to help their patients get out of pain.
Absolutely.
Is your mission, I think we've talked about this, is to educate them and say, hey, maybe there's a better way?
Absolutely. I spend a lot of time talking to other physicians. And let's face it, I mean, the primary care physicians out there, it's like a war zone now. I mean, they're overworked, they're underpaid. You know, insurance companies and Medicare keeps cutting the reimbursement, and so now they don't have enough time to deal with this huge epidemic.
Okay, so ask your primary care physician. I should see a interventional pain physician.
Right, absolutely. I think you need to see the right one.